Hi everyone, it's Dr. Renee and I'm back for my vlog. And this week I'm going to do something that I don't normally do. I'm going to divide this vlog up into a few sections, and it's because the topic I'm going to cover is contraception. And to do it properly, it's absolutely massive. So it's easier to break it down and you won't get so bored, and you can pick off the one that's of interest to you or watch all of them. So, what is contraception? So these are methods used by both men and women to prevent pregnancy. Some women use them for other things as well, and we'll go into that in the other videos. But in the main, their main reason is to stop pregnancy. There are actually 15 different methods of contraception to choose from. All contraception in the UK is free, so you don't have to pay for it. And there is confusion over the choices, the risks, and what's best for certain people depending on their medical conditions, and we're going to cover all of that. Who uses contraception? Well, I think we can safely say that from the very first time somebody becomes sexually active, and that's generally from the age of 13 and upwards, although legally at 16, all the way through to menopause, is when people need contraception if they don't want to get pregnant. So that's who uses contraception, so it's vast. We have about 40 years in our life where we're fertile and need to use contraception. In terms of who can have it, I quite often get asked, I'm under 16, can I have contraception? So the answer to that question is yes. Between the ages of 13 and 16, although sex is not legal in the UK, we accept that some children between those ages are having sex. And as long as we feel happy that they're not vulnerable and they're not having sex with someone of power or somebody who's older than them, and this is a whole other vlog, somebody of the same age, and we feel that they have capacity. So what we mean by that is that they can understand the information that we give them about the contraception, they can retain that information, they can repeat it back if asked, and they can use it to weigh up their decision-making process, and that they will carry on having sex. So it's better to protect them against pregnancy. Then yes, you can get contraception if you're under 16. So where can you get it? Well, as I said, it's free on the NHS, and there are various different places that you can get it. So you can get it from your GP, always. You can get it from pharmacies, and you can go to sexual health clinics, which again are free and completely confidential. Sexual health clinics don't even write to your GP. And I'll put a link in afterwards for how to find your most closest sexual health clinic. And if you're under 25, most sexual health clinics will actually have a walk-in service. You don't even need to make an appointment. So really it's quite simple. So we're going to start with the barrier methods of contraception for this particular vlog. And we're going to start with condoms, and there are two condoms, male and female. So let's start with the male condom, which is the one that we probably all know. So a condom is a thin plastic tube, closed at one end, open at the other. It's made of rubber or latex, and it fits over the man's penis so that when he ejaculates, when his sperm comes out, it's prevented from getting into the woman's vagina and then passing into her womb and fertilising an egg. So it keeps an egg and sperm apart. It can protect against some sexually transmitted infections, which is good because not all contraceptives can do that. There are no hormones involved, and it's 98% effective if used properly. And that's the key with all contraception, they have to be used properly. So what are the myths, risks and side effects of a male condom as a barrier contraceptive? Well, they do need to be put on before the male penis comes into contact with your vagina. It's not just before penetration. Men can actually leak a little bit of sperm in their ejaculate before they have sex, and you can actually get pregnant from that, so that's really important. You need a new condom with every episode of sex. So if you have sex more than once in any particular night, evening session, whatever you want to call it, you need a new condom each time. Even if that's only half an hour between having sex, you need a new condom each time. You need to look at the use by date because they do have one and they're not effective after that date. And you need to make sure that any condom you get has actually got a BSI mark or a CE kite mark, because these show that the condom's been produced to the high standards that we expect in the UK, and that actually ensures that they are going to be as effective as we say if used properly. You need to avoid condoms that have spermicide in them. They don't increase the effectiveness of the condom, and we know that spermicides can actually increase your risk of infection. They can actually be destroyed and therefore won't work by things like moisturiser, Vaseline, certain lotions and oil-based lubricants. They actually can also be destroyed by thrush treatment. So if you're using thrush creams or thrush pessaries or creams that go inside the vagina, be careful because that can destroy the condom as well. They are absolutely fine with water-based lubricants. So if you need a lubricant, you can use one, just make sure it's water-based. They can break or slip off, and in both of those scenarios you're at risk of pregnancy again, so you would need to seek emergency contraception if that happened whilst you were using a condom. So we recommend that the man holds the base of his penis against the body with the condom, keeping it on when he withdraws from you after sex. So just make sure it doesn't come off as he does that. If you have a latex allergy, you need to make sure that you find condoms that are non-latex, and there are some. Just check the packets or speak to your advisor or pharmacist. So that's male condoms. Now female condoms also exist, and many people don't know that. There's one provider in the UK, and that's called Femidon. The female condom is again a long tube with a ring that bends and is pliable at either end, and it goes inside your vagina. And you need to use your fingers to bend the ring and pop the female condom up inside your vagina and make sure it's sitting in the right place. It's made from a plastic, so it's not latex, which is good because it doesn't matter if you have an allergy. It stops the sperm from meeting the egg in the same way that the male condom does. And there are no hormones again, so that's brilliant news. And it's 95% effective, so it's not as effective as the male condom. So again, what are the myths, risks and side effects of the female condom? Well, it can be placed inside your vagina up to 8 hours before you plan on having sex. So that's good, and that keeps the spontaneity in the act of sex because you don't have to stop to put it in. Again, it can protect you against some sexually transmitted infections, which is great. It is possible, however, for the man's penis to slide between the condom and your vaginal wall, and if that happens you're not protected and you would need to seek emergency contraception. So that's a downside, I'm afraid. Any kind of lubricant can be used with the female condom because it isn't latex. So there are pluses and minuses, and there are no hormones again, which is quite important for some women. So there's one final barrier contraception, and that's a diaphragm or a cap. And again, it does the same thing. It sits over the cervix and it stops the man's sperm from entering the uterus and meeting your egg so that you can't get pregnant. It fits inside the vagina, so you will have to use your fingers to pop it up inside and put it in place over the cervix. And a diaphragm is slightly bigger and bendier than a cap, but they both do the same job. A doctor or nurse will measure you with a female internal exam to fit you with the correct size before you actually start using it, and they might even give you a dummy to practice with. But once you've practiced, they're actually really quite simple to pop in and out, and there are some benefits as well in terms of when you can pop them in and out. They can be put in up to an hour before you have sex, and you can leave them in place for at least 6 hours afterwards, but even longer. So if, for example, you were to have sex in the evening, you can actually leave it until the morning and take it out in the shower, which is what I found really easy when I used one, and I found them really good. You have to use them with a spermicide, so this is one where you can't use it on its own. It has to be with a spermicide. And if you were to have sex more than once whilst you're wearing the condom in any one particular session, you would have to add spermicide again. And they are 96% effective against pregnancy. So slightly less than the male condom, but more than the female condom. So again, the myths, risks and side effects. You can't use a cap or a diaphragm if you've had a prolapse, or you have a prolapse where the walls won't hold it in place. So women that have had children, overweight, or have had some sort of trauma to their vagina, or have an abnormality to their cervix or their vagina, then you can't use one either in terms of its structure. You can't use it if you've got a latex or a spermicide allergy because they are latex and you have to use a spermicide. You can't use them if you've had toxic shock syndrome, so that's something that you get from tampons and leaving them in a little bit too long, but that's become quite rare nowadays. And you can't use them if you have repeated urinary tract infections because they can increase that. If you lose more than 3 kilograms of weight or gain more than 3 kilograms, you have a baby, you have a termination or a miscarriage, then you will need to be refitted because you might need a slightly different size. And you need to remember that the spermicide used can increase your risk of infection. So those are the pluses and minuses again of diaphragms and caps, and once again there are no hormones involved, which for some women is really important. So overall, that's the barrier contraceptions, all available in the UK very easily and all free. There are no hormones and you only have to use them when needed, so when you're having sex, so it's not something you have to use all of the time. They give you some protection against sexually transmitted infections, and the other thing is that there is some planning required, but not so much with some of the female methods. And of course the female methods put you completely in control of the female. So if you have a partner who's not keen on condoms or doesn't always want to use one, you can be in control by using either the female condom or a barrier method like a diaphragm or a cap. They can fail if not used properly. So how do you decide? Well, I guess with these methods, it's about, will you remember to use it every time? Can you put your fingers into your vagina? Can you reach your cervix? And are you happy doing that? Will your partner always support you and use a condom if you give the responsibility over to him? So I'm going to put some links in the notes afterwards that help you choose a contraception that's right for you. And then next week I'm going to talk about the combined hormone methods. So that's the pill, and there are lots of different ones of those. It's the patch, which is called Evra, and it's the ring, which is called NuvaRing. So there are 3 of those, and we'll chat those through next time. In the meantime, any questions on anything I've covered today, or any questions for the ones that are coming up, please let me know. And as always, thank you so much for listening.